the IMbrave150, we got the IMbrave study of atezolizumab and bevacizumab in unresectable HCC, and we got the updated survival data at ASCO GI this year. And I think the best part about the study is just the fact that this is like the longest survival that we've seen in a phase 3 study for HCC to date, right? There was after the overall survival was 19.2 months with the atezo-bev combination, and it just continued, right? We saw this benefit earlier, but the benefit and the overall response rate up to 30% in this disease with this combination is really amazing. The good thing really interesting thing we saw is that there was no biomarker that we saw that would tell you that, oh, this patient's going to respond better to atezo-bev versus not. They looked at PD-L1, they looked at different other things, but they really didn't find any. The interesting thing about this study was you do see side effects. There's about a 43 to 44% grade 3 treatment-related adverse events seen even with the atezo-bev arm. And we all worry about the fact that, variceal bleedings with the bevacizumab is always a concern. All the patients required an EGD prior to getting onto the study. The study did cherry pick patients. Typically that's what all the studies do. You only have Child-Pugh A patients in there. So when you I think, when you use it in clinical practice, these are the caveats that sometimes we don't see the patients that actually got treated on the clinical trial. Having said that, if you see a patient who's Child-Pugh A, doesn't have varices or they've been treated, there's hands down nothing better than a atezo-bev combination. What I really I'm using it more and more in clinical practice, getting more comfortable with it. And this is FDA approved, the best standard of care option that's available out there. There are some other studies that are coming in the same area. There's a combination of cabozantinib plus atezolizumab. There's a combination of lenvatinib as well as pembro, and then the combination of two CTLA-4 as well as PD-L1 inhibitor, durva and tremi, and they're all done. They're about to read out, and they've all been compared to sorafenib. So we wouldn't know how to compare all of these together. Having said that, it just gives us more options, and that's amazing.